Bloodborne pathogens. The mission of the Occupational Health and Safety Administration, OSHA, is to save lives, prevent injuries, and protect the health of America's workers. As part of the Department of Labor, OSHA promotes worker safety and health in every workplace in the United States. OSHA's Bloodborne Pathogen Standard protects employees who work in occupations where they are at risk of exposure to blood or other infectious materials. The following Exposure Control Plan, ECP, is provided to eliminate or minimize occupational exposure to bloodborne pathogens in accordance with OSHA standards. The ECP is a key document to implement and ensure compliance with the standard, thereby protecting employees. This ECP includes determination of employee exposure, implementation of various methods of exposure control, including universal precautions engineering and work practice, controls personal protective equipment housekeeping, hepatitis B vaccination, post-exposure evaluation and follow-up, communication of hazards to employees and training, record keeping, procedures for evaluating circumstances surrounding exposure incidents. Personal protective equipment, PPE. All employees using PPE must observe the following precautions. Wash hands immediately or as soon as feasible after removing gloves or other PPE. Remove PPE after it becomes contaminated and before leaving the work area. Wear appropriate gloves when it is reasonably anticipated that there may be hand contact with blood, and when handling or touching contaminated items or surfaces. Replace gloves if torn, punctured or contaminated, or if their ability to function as a barrier is compromised. Utility gloves may be decontaminated for reuse if their integrity is not compromised. Discard utility gloves if they show signs of cracking, peeling, tearing, puncturing, or deterioration. Never wash or decontaminate disposable gloves for reuse. Wear appropriate face and eye protection when splashes, sprays, spatters, or droplets of blood or opium, other potentially infectious materials, pose a hazard to the eye, nose, or mouth. Remove immediately or as soon as feasible any garment contaminated by blood or opium in such a way as to avoid contact with the outer surface. Housekeeping. Regulated waste is placed in containers which are closable and constructed to contain all contents and prevent leakage. They are closed before removal to prevent spillage or protrusion of contents during handling. Contaminated sharps are discarded immediately or as soon as possible in containers that are closable, puncture-resistant, leak-proof on sides and bottoms. Bins and pails are cleaned and decontaminated as soon as possible after visible contamination. Broken glassware that may be contaminated is only picked up using mechanical means, such as a brush and dustpan. The following laundering requirements must be met. Handle contaminated laundry as little as possible, with minimal agitation. Place wet, contaminated laundry in leak-proof, labeled, or color-coded containers before transport. Wear appropriate PPE when handling and sorting contaminated laundry. Hazard Communication Standard. The following Model Hazard Communication Program is based on the requirements of the OSHA Hazard Communication Standard, 29 CFR 1910.1200. Company policy: to ensure that all affected employees know information about the dangers of all hazardous chemicals used, the following Hazardous Information Program has been established. Under this program, you will be informed of the contents of the OSHA Hazard Communication Standard, the hazardous properties of chemicals with which you work, safe handling procedures, and measures to take to protect yourself from these chemicals. This program applies to all work operations in our company where you may be exposed to hazardous chemicals under normal working conditions or during an emergency. What is the Needlestick Safety and Prevention Act? The Needlestick Safety and Prevention Act was signed into law on November 6, 2000. Occupational exposure to bloodborne pathogens from accidental sharps injuries in healthcare and other occupational settings continues to be a severe problem. Because of this, Congress required the modification of OSHA's bloodborne pathogen standard to outline in greater detail OSHA's requirement for employers to identify, evaluate, and implement safer medical devices such as needleless systems and sharps with engineered sharps protection. Preventing the spread of bloodborne pathogens. Bloodborne pathogens, such as bacteria and viruses, are present in blood and body fluids and can cause disease in humans. The bloodborne pathogens of primary concern are hepatitis B, hepatitis C, and HIV. These and other bloodborne pathogens are spread primarily through direct contact. Infected blood or body fluid from one person enters another person's body at a correct entry site, such as infected blood splashing in the eye. Indirect contact. A person's skin touches an object that contains the blood or body fluid of an infected person, such as picking up soiled dressings contaminated with an infected person's blood or body fluid. Follow standard precautions to help prevent the spread of bloodborne pathogens and other diseases whenever there is a risk of exposure to blood or other body fluids. These precautions require that all blood and other body fluids be treated as if they are infectious. Standard precautions include maintaining personal hygiene and using personal protective equipment, PPE, engineering controls, work practice controls, and proper equipment cleaning and spill cleanup procedures. To prevent infection, follow these guidelines. Avoid contact with blood and other body fluids. Use CPR breathing barriers, such as resuscitation masks, when giving ventilations, rescue breaths. Wear disposable gloves when providing care, especially if you encounter blood or body fluids. Also wear protective coverings, such as a mask, eyewear, and a gown if blood or other body fluids can splash. Cover any cuts, scrapes, or sores, and remove jewelry, including rings, before wearing disposable gloves. Change gloves before providing care to a different victim. Remove disposable gloves without contacting the soiled part of the gloves and dispose of them in a proper container. Thoroughly wash your hands and other areas immediately after providing care. Use alcohol-based hand sanitizer where hand washing facilities are not available if your hands are not visibly soiled. When practical, wash your hands before providing care. To reduce the risk of exposure, follow these engineering and work practice controls. Use biohazard bags to dispose of contaminated materials, such as used gloves and bandages. Place all soiled clothing in marked plastic bags for disposal or cleaning. Biohazard warning labels are required on any container holding contaminated materials. Use sharps disposal containers to place sharps items, such as needles. Clean and disinfect all equipment and work surfaces soiled by blood or body fluids. If you are exposed, take the following steps immediately. Wash needlestick injuries, cuts, and exposed skin thoroughly with soap and water. If splashed with blood or potentially infectious material around the mouth or nose, flush the area with water. If splashed in or around the eyes, irrigate with clean water, saline, or sterile irrigants for 20 minutes. Report the incident to the appropriate person identified in your employer's exposure control plan immediately. Additionally, report the incident to emergency medical services, EMS, personnel who take over care. Record the incident by writing down what happened, including the date, time, and circumstances of the exposure, any actions taken after the exposure, and any other information required by your employer. Seek immediate follow-up care as identified in your employer's exposure control plan. Occupational Safety and Health Administration, OSHA, regulations require employers to have an exposure control plan, a written program outlining the protective measures the employer will take to eliminate or minimize employee exposure incidents. The exposure control plan guidelines should be made available to employees and should accurately explain what they need to do to prevent the spread of infectious diseases. Additionally, OSHA requires that after appropriate training has been completed, a hepatitis B vaccination series be made available to all employees who have occupational exposure within 10 working days of initial assignment. However, employees may decide not to have the vaccination. The employer must make the vaccination available if an employee later decides to accept the vaccination. Check out OSHA's website, www.osha.gov, or refer to your employer's exposure control officer for more information on OSHA's Bloodborne Pathogen Standard, 29 CFR Part 1910.1030. This course covers important topics of bloodborne pathogens, but there is still more information about the topic. For more information, there are several resources available for employers and employees about occupational exposures to blood and opium. One valuable resource is OSHA's website, or you may contact them by phone at 1-800-321-OSHA 6742. Remember, follow the exposure control plan to eliminate or minimize occupational exposure to bloodborne pathogens. Your life and the life of others depend on it.